Our next presentation is on Los Angeles County and Ebola preparedness. The speaker is Dr. Laurene Mascola, Los Angeles County Department of Public Health Acute Communicable Disease Program. Dr. Mascola.
Okay, so first of all, Zach, I didn't see you calling me on your algorithm anywhere, so you're in trouble. So again, it's there somewhere. Okay, so again, I'm going to talk about how hard it is to think about Ebola in LA County, because obviously it's very complex and diverse, so I don't want you to send me pity mail. But again, I want to say I'm very honored to be here tonight and for you to think about actually having someone from the Public Health Department come and speak to you about what we're doing to keep you and the rest of the country safe from Ebola. Because I've been here, as chief of acute communicable disease control as opposed to not acute disease. But I've been working for over 28 years between white powders, SARS, MERS, anthrax, smallpox, and really nothing has been so time-consuming as working on Ebola preparedness. Again, a lot of it is because it's so complex and involves so many different areas, and also because of the high case fatality rate that we've seen overseas, although luckily there's a good article today in the paper that all 5 of the patients that have been treated here, except for Mr. Duncan, who probably came with an advanced stage of disease, have done fairly well and have all survived. So we've been doing pretty good then. But let me tell you about what problems we're having when we have to deal with preparedness here in LA County, and actually what is public health. So who here even knows what public health is? So as opposed to Zach, who has patients here that just talk about UCLA, for me, the patient population is all of LA County, which is about 10 million people. So again, here's a nice view of LA County, and actually it's gotten nicer over the years. There's no more smog. It really looks very pretty when you think about it. But again, we're very big, both in size and population. In fact, when you look at us, we have over 4,000 square miles. It includes a lot of different geographic areas, mountains, deserts, 80 miles of coastline. We're divided into 8 different service planning areas called spas. Has nothing to do with bathing, but that's what we call our service planning areas. And, we don't want to have anyone panic, but we actually have a very large area. In fact, if you think about us, we're actually bigger than 42 different states. So, we have about 10 million people, and it's the most largest and most densely populated of any U.S. county. And we're only, as I said before, exceeded in population by 8 different states. And in fact, 1/4 of all Californians live here in LA County. And now you wonder why I don't sleep at night. And in addition to that, New York City and I were very good friends. Marcy Layton is actually my counterpart in New York City, but she has it easy because there's one city health department, there's one city fire department, one city school district. Not so in LA County. We have 88 different cities, each with its own mayors and own city managers. We have over 100 hospitals with different, ERs. We have 457 acute healthcare facilities. We have more than 30,000 licensed physicians. We have 80 different public health school districts, plus private, parochial, charter. We have the largest jails, prisons, and juvenile detention systems in the nation. And we have more than 25,000 retail food purveyors when you think of all the places you can go out to eat. We also have a very complex infrastructure ourselves when you look at our own county health department, where we have 39 different programs. In fact, LA is so big that we actually receive separate federal funding for a lot of programs, like for bioterrorism preparedness, like some of the other large cities, so we're really considered like a large state. So we have a lot of things to do, and communication is always a challenge. That's why this is a great opportunity to talk about what we do for you. And again, not only does LA County have diverse with respect to geographic area, we have most millionaires of all the rest of the U.S. county, 4 times more than New York City. But on the other hand, we have 2 in 5 people that live in poverty, the rate which significantly increases as you go through different parts of LA, like central LA. We have a lot of homeless people, many medically underserved, and a lot of uninsured people. So again, that really complicates healthcare. We have many different cultures and languages, so you can understand how actually trying to do education is very challenging. About 36% of our population is actually foreign-born, second only to Miami, and half of our residents actually speak a language other than English in their home. And again, second to their country of origin, we have the largest population of Armenians, Cambodians, Guatemalans, Hungarians, Israeli, Koreans, Thais, Mexicans, Salvadorians, and Vietnamese. So we are very complicated, and we're very mobile. We have a port. Obviously, we have a port that, has a container volume of almost 8 million. We have all these passengers coming in and out, to Long Beach. We have LAX, as you all know, we're over 40 million domestic travelers come in and out, and 14 million international travelers yearly, and we're the 3rd busiest airport. We have very rare diseases. This is one really strange place where some guy was trying to smuggle in some rare Asian cats going through customs, and you wouldn't believe what people tried to smuggle in through LAX. And this guy had it in his underwear. We also were the first place that actually had the AIDS epidemic, was actually first described here. One of your gentlemen actually out in the west side of town who discussed assisted screening eye and men who had sex with men. So again, we always have novel and emerging diseases. We had SARS, we had 22 investigations, we had MERS, we could have chikungunya here if you wanted it because we have the mosquito vector, Aedes albopictus. We have other travel-associated illnesses, but hopefully not Ebola. But are we prepared? So I think we can say that we are prepared. Because even though, as everyone's talked about, all the different cases of Ebola in the countries affected, and the fact that someone really didn't say that if we don't start working overseas, that there are estimates that there could be 1.4 million cases by September of 2014 with over 900,000 deaths. So we really have to start to get, actually 2015, not 2014, we really have to start to get our act together to start working over there, otherwise we're really going to be in problems. So again, we need to work with everybody. So ACD is really just one of many spoken and wheel of many different agencies that we have to collaborate, coordinate, and consult with to help uncover infectious diseases. So how is your county prepared? Well, first of all, there's only about 100 people that come in every day to the U.S. from West Africa. Out of the 3 countries that are currently affected, out of those, California gets about 9 a day. 9 a day or 9 a week. So out of those, we only 1 or 2 come to LA County. So we're very lucky. We're not one of the 7 cities. 70% of all the travelers that are coming in from West Africa actually go to East Coast cities and Georgia. So again, I've always associated that with maybe having taxis, because a lot of the times that's a great profession for a lot of West Africans when they come over here is to drive cabs. You don't need a lot of skill sets, just a GPS system, but we don't have a whole lot of cabs in LA. So I think that's why we're spared that. But on the other hand, we as your health department know about every person that now comes in from any West African country. All those people are funneled through 5 different airports, their planes are rerouted, their information is gotten, they're screened, they're given a kit to take their temperature, and then they are put on a conveyance to go on their way. So if they come in through Dallas, and LA is their final destination, they land in LA, that information goes up to the state of California, comes down to LA County, and then we currently monitor those people. We call them country contacts. In other words, just from coming from an affected country, you are now on our watch list for 21 days. The public health department makes a home visit, and then we call you twice a day to make sure that you're taking your temperature. So anybody who comes from an affected country, who let's say in their 21-day period of incubation gets sick, we will know about a priori. So before we just send them to any ER, we'll actually have EMS involved, or we'll call them and say we have a potential Ebola patient. We'll call Zach ahead of time and say we're going to be transporting someone to your ED. So hopefully no one's just going to walk into an ED room and just say, surprise, here I am. But on the other hand, we do expect all 100 hospitals to be prepared to take histories from any patient that does walk in, to do, like Zach said, to do a travel history about the current 3 affected countries, as well as asking them if they came in contact with any Ebola patient from New York City or from Texas. I saw you had the Middle Eastern countries on your screening form for MERS. Taking a travel history is always important for a lot of other infectious diseases. And besides just educating all 100 hospitals and 30,000 clinicians, we also have to work with, education programs. We have to work with LACO and LAUSD because they're worried about students coming back, potentially exposing other students with Ebola. We have to work with DPSS. So in other words, if the family was on home quarantine, which again, we do not have any under home quarantine at this point, and hopefully if our governor doesn't follow suit with some other governors, we'll never have anyone under home quarantine. We would have to have access for them to have food, waste disposal, and perhaps educational plans for their children. So again, we have to work very, very hard. We work with the Hospital Association of Southern California. We work with the FAA. We work with the CDC, the Quarantine Division. We're in contact with them. We work with EMS. We work with fire, sheriff, and police. Animal control. The other day, someone was saying, well, what happened about that pet, like the poor nurse in Spain whose pet was actually euthanized. They do find antibodies in dogs. There's no real data to show that dogs can actually transmit Ebola virus, but because, again, of unknown and fear, people are wondering, like that pet that the nurse had in Texas. I don't know where that pet went, but we're trying to discuss where would the pets go in LA County if this thing came down with Ebola. I volunteered in my backyard. I said I have no worries. They can also live in my other muds. but we are looking for someone to come up to the plate to watch for those. And, you know, you name an organization and we here in LA County work with it. And so, to paraphrase a famous person, it takes a village to manage an outbreak. So here in LA County, it takes everyone to help us manage everything. And I really appreciate you asking Public Health to come here today because, you know, we don't know what the future will bring. And we're really looking forward to being collaborative partners, not only for this, but for all the diseases and chronic conditions that are affecting the health of our population. Thank you very much.